everyone. My name is Dr. Yael Mayer, and I'm a clinical counselor and an individual and family therapist. I'm an expert in working with children and their families. I'm here today to help you speak with your children about the coronavirus. You probably asked yourself, how do I speak with my children about it? But how exactly I provide this information to my kids? I know that that's complex, so I'm here to help you. Imagine that you're a captain on a ship, and your responsibility is to lead the ship and your passengers into safety. Suddenly, a thunderstorm is starting, and the ship becomes rocky, and your passengers, they get stressed and panicked. They wait for their captain to speak with them and provide them information, support, and reassurance. The ship is kind of like your family, and the passengers are kind of like your kids, and you are the captain of your family. So your children are waiting for information and support and reassurance from you in this situation. I want to give you a few tips on how to be a great captain for your ship. So tip number 1. When you start a conversation with your children about the virus or the situation and the changing routines, try to be aware of yourself. Try to think, am I swamped with feelings right now? Am I overwhelmed? Am I calm enough to conduct this conversation? Try to take a deep breath and find the right moment where you're feeling calm and you can speak with your children. Try to speak with your partner and find who's the right person and who's the best person and the most calm person in the situation to provide information. Tip number 2. Start by asking your kids, what do you already know about the coronavirus? They probably heard about it from their classmates, from their teachers, their friends. Ask your children, what do you think about this situation? How do you feel about it? Do you have any questions? Provide your children with accurate information, with the truth, be authentic, and try to provide information in a way that is age appropriate. Some kids wouldn't like to hear about it, and that's okay too. We have to respect their natural defense mechanisms, and for some children it's better not to speak about it right now, maybe speak about it later. Tip number 3. Provide your kids with reassuring information, such as that kids almost don't get sick from the virus. Also, let them know that they also have control on the spreading of the virus, so they could do things to stop it. For instance, if they wash their hands well, if they cough into their elbows or avoid touching their faces. All of these things could help their family, but they're also an act of kindness to the community. So children will feel that they have control, they have a role, and that is also reassuring. And lastly, you know your kids the best. So sometimes you already feel that something is not quite right. Maybe it's your child that is not sleeping well or not eating well, or maybe your child became very aggressive, or they're complaining a lot about headaches or stomach aches. All of these could be signs of anxiety and stress. Don't ignore those signs. Is their body speaking that they're stressed? Try to speak about it with them and provide them with support. Don't be ashamed to seek for professional help. Professional advice could be a huge help in this time. Thank you so much. Good luck and take good care. Bye.